Hi, I'm Taylor. I'm going to be diagnosing the patient today. Could you introduce me?
Hello, this is Dr. Mohammed speaking. This is your patient. Her name is Rukaya Hassan,
Could you repeat it
and
for me?
she's yeah, tana gaishe ki wai. So she says she's also saying hi to you.
Okay, so
Yeah,
how old is our patient?
shekaran ki nawa wai? So her age is 20. She's 20 years old.
Okay,
Yeah.
and so could you ask her if she would let me ask some personal questions?
All right. To tana so ta kara miki wani tambayoyi ne. She said you can go ahead.
Okay. Could you ask her to tell me about her personal life, about her family, and any work that she does?
Okay, tana so ki dan mata bayani akan ki ne kaman ko kina da yara ne, kina da aure ko kina wani aiki da sauransu. Okay, okay, okay. So she said she is married. She has a daughter, and she is not gainfully employed.
And how old is her daughter?
Wai yarinya na ki shekaranta nawa? She says the daughter is 1.5 years old.
And could you ask her why she came in to see the doctor today?
All right. Ta so ta san me yasa kika zo asibiti? Me yake damun ki? All right. She said she's having fever, headache, and body weakness.
Could you ask her to describe the fever, whether it's continuous or whether it stops and then comes back and then stops again?
So ciwon nan yana zuwa ya tafi ne ko kuma yana nan kowane lokaci kuma da yaushe ya fi miki? Okay. All right. So she said this the fever comes and go, and she is more in the evening.
Okay. And could you ask her to describe whether the headache is generalized to a certain part of her head or if it's pretty much everywhere?
All right. Ciwon kai din ne gaba ɗaya yake yi ko kuma wani bangare ne? Okay. She said the headache is generalized headache.
And could you ask her if she's feeling any other symptoms?
So kina jin wani abu ne daban kaman ko ciwon ciki ko amai ko gudawa? All right. She said she doesn't have any other symptoms.
Okay.
Yeah.
So I would like to do a rapid diagnostic test and a blood culture to see if she has any malaria or any bacteria in her body.
All right. A rapid diagnostic test for this patient reveals 2 pluses of malaria, and blood culture did not yield any bacteria.
Okay. And I would
Yeah.
also like to run a full blood count just to make sure that she isn't anemic. So I would like to run a full blood count to test her hemoglobin levels.
Yes. Hemoglobin levels for this patient is 13 grams per DL.
Could you repeat that?
The hemoglobin levels for this patient is 13 grams per deciliter.
Okay, so I would like to diagnose her with a uncomplicated case of malaria. The reason for the
Okay.
uncomplicated part of malaria is because she is not anemic because her hemoglobin levels are in the normal range of 13 grams per deciliter.
Good. Good. That's good.
Okay. And so for treatment methods, I would suggest an ACT treatment, an oral
Okay.
ACT
That's good.
treatment because
Good.
it's not complicated, and so the oral ACT treatment
Yeah.
should work. And
All
then
right. That's good.
for prevention techniques, I would also suggest, since she got bitten by a mosquito, I would suggest mosquito repellent. And then I would also suggest wearing long sleeve shirts and pants. And then when she's sleeping, I would suggest sleeping with netting and then with her windows closed.
Well, that's very great, Taylor. You're actually able to know this patient has malaria from her symptoms, and it's good that you try to find out the cause of malaria. And you also stated the method of testing, which is rapid diagnostic testing for this patient, which revealed two places of malaria. That's correct. And you also try to rule out typhoid fever by doing blood culture, which is very good, and it shows the patient doesn't have also even. And you also try to rule out anemia. That's very good because anemia is a very common complication of malaria. You did very well to rule out that. And you also suggested the correct treatment, which is ACT combination for this patient. She's having an uncomplicated malaria, so oral ACT is good for her. You did very well by saying that. And you also stated means of future preventions, which is very good. Wearing of long sleeves, sleeping on the mosquito-treated nets. So congratulations, Taylor. You have done very well.
Thank you. Tell her I said
You're
thank you
welcome.
for coming in, and I hope that she feels better.
All right, tana gaishe ki kuma tana miki fatan Allah ya saki samu sauki. So she says she's also very grateful, and you are welcome, and she's very happy for what you people what you people have done to them, and you are very welcome.